ahead,
I
Jeff,
just
go ahead.
had a question as to client tracking and picking up on points that you're saying. I have a 10-year-old son who is profoundly disabled. My family's doing okay, but negotiating the system is a nightmare. And it's not lost on me that what do you do if you're working all the time? I imagine that your client base is also families that maybe are asset limited, and one medical crisis, mental health, whether it's medical or mental health related, can send a family reeling. I guess my question is there an initiative or a portal where it's one place where maybe, and if you could let all of us here know, so when we walk away, we can tell other families, if you need help, regardless of whether it's access to food, whether it's access to treatment, whether it's access to housing, where do you go so that you can make that one phone call? And if there isn't, is there an initiative to address this, to make it easier for families to advocate for themselves?
I can give a quick response.
Go ahead.
I think with the organizations that we work with, we're trying to do that, to provide wraparound access to services for the people that we touch. But you ask a much more important question, which is how are we doing it broadly? There are some states I work with in the Northeast that are looking at one-stop shopping. A friend of mine runs a United Way. He said, James, I have people come in, I have to send them to 10 different organizations. And it's crazy the way it's done, and we need to change it. And I sat at a meeting once with the governor, and this is in Massachusetts, with the Department of Education, Health, Agriculture, Social Services, and it was the first time we had all met together, and we realized we were touching all these clients in different ways, but we weren't working together. So I don't think it's there yet, but it's a really important issue.
Either one, go ahead, Jan.
Yeah, you bring up a really important issue, and one that we hear a lot, unfortunately, because that's, but one of the bright spots we're finding within the homeless service system is that they have been working to create what's called a coordinated access network. And with 211 as being the portal where families can get diverted, and then for those families who do need services, then they can get connected to kind of a coordinated assessment process. It's not perfect, it's still a work in progress, but I think it is using some of the things that Roseanne talked about really looking at how people flow through and how you can make that more efficient, and being held to performance standards around how quickly does someone get assessed, how quickly does someone get connected to services. And it's really the funders of public sector and private sector funders that can really demand performance around human services.
Roseanne?
The only thing I'll add to Janice's and James' comments is, like, we all have to demand it. That this should be what we get as citizens. That when we're in trouble, or that it's easy to access what we need. There is no gain in making people in crisis go to 10 different places. And I think Janice is absolutely right. In a strange way, the homelessness system, because homelessness is such a catch-all for other system failures, we're learning things in homelessness and pushing to solve this that can transform every human service interaction.